We have some breaking news at this hour. The Vatican saying Pope Francis experiencing a sudden worsening of his respiratory condition. The 88-year-old pontiff remains alert and oriented and is cooperating with therapeutic measures 2 weeks into his hospital stay. Let's bring in our senior national correspondent and ABC News Live anchor Terry Moran in Rome, along with emergency medicine physician Dr. Stephanie Widmer. Terry, what can you tell us about this update that we're getting at this hour about the Pope's condition?
Well, Elizabeth, there's no question this is a setback for Pope Francis. He's had a few good days, which the Vatican had described as gradually improving his condition. But now they tell us that early this afternoon, the Pope had basically a coughing fit, which led to vomiting, and he inhaled some of that. They aspirated his lungs and put him on aggressive ventilation, and they are happy about the result of that. But they are now saying that they still want to look 24, 48 hours out to see if there's infection that results from that or if this respiratory problem improves at all. This is, as I say, a setback. This morning he was continuing respiratory physiotherapy. He was, improving the quality of his lung function is the aim of that. But then he had this coughing fit leading to the vomit, and then that ended up in an emergency situation. A crisis is what they're calling it. They are not, however, saying that his condition has been downgraded back to critical, which is what it was last week. They say it's still guarded, and they need to watch him very closely, especially over the past 24 to 48 hours. But this is certainly a setback in what had been, no question, small but steady progress over the past few days.
A setback, as you say. Dr. Widmer, can you tell us what you make medically of this update that we are hearing from the Vatican?
When someone is hospitalized or battling a serious illness, there can be setbacks at any time, and the patient is at risk for serious complications. So what we're hearing based on this coughing fit, and he had an episode of vomiting during the coughing fit. And as you can imagine, if you're vomiting and also struggling to breathe at the same time, inhaling some of those gastric contents can cause inflammation, injury, and sometimes worsening infection of the lung. The fact that they put him on a breathing machine, now what the term that was used was a non-invasive breathing machine. So a breathing tube was not placed in his trachea, but it's more of a mask that helps provide more oxygen and pressure support. And, individuals can be on this for a short period of time or a long period of time. It really depends on their clinical condition and the specific case and the specific patient. So we will have to stay tuned and find out, how long he's going to require this extra oxygen and breathing support.
And we are, of course, wishing him well as part of this ongoing recovery. Terry Moran and Dr. Stephanie Widmer, thank you both so much.